Amazed at the energy level this late in the day on a beautiful sunny day in Toronto. This is great, folks. I'm pleased to introduce our host plenary session, Working Together to Advance a Modernized Health System. And this session will highlight the efforts of three national organizations, the Canada Health Infoway, the Canadian Institute for Health Information, and Digital Health Canada. We're working close together, collaborating with one another, along with federal, provincial, and territorial governments and other key stakeholders to advance the vision of a modern health system based on a foundation of interoperable health data. Please join me in welcoming Cassie Fraser, Mark Castleman, Anne Forsyth, and Abby Calra to the stage.
Thank you. Welcome, everyone. My name is Abby Calra, and I'm an EVP at Canada Health Infoway, responsible for driving our pan-Canadian strategy for interoperability. For a change, I'm wearing the role of a moderator today, the hat of a moderator, and I'm really looking forward to engaging you all and the three elite panelists that we have today. Before I dive into introducing them, I re-looked at our topic, which is working together to advance modernized health system. The session itself has got three powerful messages. Working together, which is really talking about the theme of collaboration, partnership, everybody coming together. Advance, which is a call to action that status quo is not accepted, so we need to do something to actually advance this. And finally, modernizing health system, which is really about the fact that we're acknowledging we all share a common vision. The vision of building a modernized health system where the information could seamlessly be accessed and exchanged. So today, we're going to talk about the important intersection of people, process, and technology as we go about modernizing our health system, but also I would call a transformation journey as far as healthcare is concerned. Most of the transformation exercises are only successful when everybody comes together, all the stakeholders come together, and they share a common goal, a common approach, but most importantly, a unified methodology to move forward the agenda. And I'm glad to say, we're in that time, where the environment has never been so much suitable, for all of us to actually come together and advance this. In today's session, we will actually hear perspectives from three key organizations who are working with their stakeholders: Canada Health Infoway, Digital Health Canada, and Canadian Institute for Health Information. These are the three organizations who are doing their part and engaging their stakeholders to bring forward the work that we heard this morning from our health minister. Sorry. So for today's session, we have three panelists, so let me introduce them. Mark Castleman, CEO for Digital Health Canada. Cassie Fraser, Senior Director for Canada Health Infoway, and she's also wearing the hat of President and Chair for Digital Health Canada. And Anne Forsyth, who is the Manager for Data Standards, doing some critical work in terms of defining the foundational data for pan-Canadian needs. In terms of the format, how we're going to run this is I will invite each of the panelists to come and speak to their perspective, to their content in terms of what they are doing individually and their organizations are doing to advance this work. And then we're going to talk about some polling questions, interesting sections, and then also engage you to come forward and ask some questions. There are a number of ways that you can actually engage in today's panel session. I'll start with some topical questions, after their presentations, and then we have some polling questions, that you'll respond to. I just want to make sure that, you're set up as far as, WHOA app is concerned. So if you can just quickly follow the instructions and make sure that you're all ready and set up, because it will be great to have your participation, when we go into the polling section. Just a quick test. Open the WHOA app on your smartphone and you can locate the host plenary session from the conference agenda. Within the plenary session, you can click on the poll tabs, and you can participate in the poll by selecting your answers to the options which are displayed. So we'll have a test question. If you can start responding to that. So what have you valued the most in your experience at eHealth Conference 2023 so far? Networking, attended an engaging session, which I did, a couple of them, trade show or exchange contact information at exhibitor's booth, met an innovator in the startup zone, or all of the above. We also have virtual attendees, about 300 of them, so we'll also view their results as we go. And results are starting to pour in. Networking, attending an engaging session. Fantastic. So it looks like we're off to a great start. Okay, so now that we've got our practice out of the way, let's focus on. Before I hand it off to our panelists to talk about their individual pieces, I do want to actually emphasize on why it is absolutely critical, that we all are coming together, and why this is absolutely the right environment for all of us to acknowledge why we need a modernized health system. And the great news is these are the three objectives that I think everybody has shared in some shape or form. We may have used different words to describe that, but I think the importance of achieving these three goals, or the outcome of these three goals, as part of the common shared goal for modernized health system. A person-centric model, a person-centric approach, where patients are at the center, where they can not only access their data, but they can also manage their data. They can exchange their data. They can carry their data wherever they want to. We heard it from the patient advisor this morning, the importance of carrying the patient record, not in a paper format, but in an electronic format. So these are the real stories, that we're facing on the ground, and why this is important. We need to do this. Connected care, it talks about the whole the health system on the whole. We talk about patient-centric model, but there's also provider-centric model. How do we make sure that the providers are able to access and exchange electronic information amongst themselves in order to facilitate, better care, in order to facilitate, efficient care? So that's a fundamental goal of connected care. And finally, innovation. The first two goals are focused primarily on the clinical usage of the data, but what about the secondary usage of the data? How do we actually support innovation by making the aggregated data available, make decisions, based on the availability of the data, the population and the health-based outcomes, with standardized data that is available, and also making, open specifications available to the marketplace, so that, the new innovators can actually develop innovative and cutting-edge solutions that are acceptable, right? They don't run into the challenges. How do we make it easy for our startups to actually deliver the solutions which are acceptable within the jurisdiction? So those are the three fundamental goals. Again, as I said, we may have used different words to describe that, but that is really at the heart of it, that we're trying to drive as far as our common goal is concerned. So with that perspective in mind, I would now like to turn it over to Mark to talk about, what the organization is doing and provide his perspective.
Very good. Well, thanks, Abhi. First of all, it's wonderful to be in this room here today with everyone. The energy has just been phenomenal, and it's great to be part of such a rich set of conversations as we talk about modernizing our health system. From the standpoint of Digital Health Canada, we tend to take the position that it's all about the people. The folks in this room here with us today, the individuals across our country that are doing the work, building, designing, evaluating, implementing technologies and information to help to improve the health of Canadians. Our mission at Digital Health Canada is to connect, empower, and inspire the individuals who are building the future of healthcare in Canada. And I want to talk a little bit about the things that we're doing from the standpoint of building collaborative networks, working closely with our partners at Infoway, Kai, and many organizations here with us at the conference today, and the importance of upskilling our workforce. We heard a great keynote this morning to help to identify some of the core elements and really shape the explosion of skills as they move away from the pure play of the jobs themselves. It's really important that we continue to invest at the individual level, the organizational level, and at the health system level in our people so that we are able to develop and implement these big goals that we have from an interoperability standpoint. I've put down 4 elements here that I just want to introduce to get the conversation going with us today. The first is the demographic shifts that are happening. And we see it here in the room. Our workforce is changing. We now have more demographics, more ages in the workforce from a diversity standpoint than we've ever had before. We ran a survey recently with our membership. Many of you participated in our annual survey at Digital Health Canada. It was quite reflective of where we sit currently in the demographics. 20% were emerging professionals, 0 to 7 years in the industry. About 20% were established professionals, 8 to 15 years in industry. 35% were mid-career, so 16 to 25 years in industry, and another 20% were late career, beyond 26 plus years in industry. We had students and retirees on either side as well. As we think about training, as we think about skill development, developing professionals, it's really critical that we consider the mindsets, the experiences of all of these groups as we go forward to think about those elements that we need to build in. Engaging newcomers in career pivots is really important for us. The federal government has set out a strategy to bring 500,000 newcomers to Canada each year over the next 3 years. Digital Health Canada has done work in this space, and we believe it's really important and critical that we bring on board as many skilled professionals as we can selfishly into the health and into the healthcare space to help us from that standpoint as we look to implement new technologies across the board. We have many individuals coming into healthcare mid-career and later from retail, from other industries who also require skilling up, training and understanding how to apply their skills in the healthcare field. Third is accelerating interdisciplinary collaboration. This is a critical ingredient for success, whether it's implementing, whether it's change management. The notion of having a common set of language, a common understanding of the basic skills for health informatics to be able to converse and share that across the clinical realms, technology realm, business operations, and financial leadership. And the more we can provide those common languages and training sessions to improve that interdisciplinary collaboration, that will be a key ingredient as we move forward with this impressive mandate for interoperability. And then finally, keeping pace with digital transformation. We recognize, number 4 here, we can't do this ourselves. And it's incumbent upon all the players in this room. At Digital Health Canada, we've really been working towards creating a foundation that draws in industry partners, other partners, associations in this space who are developing training tools and skills, things like training courses for cloud architects, to bring those in and distribute them across the professionals working in our space, across all those demographics, to newcomers and those individuals who are pivoting in their career, and making sure that they're available for our interdisciplinary collaborative teams across the healthcare setting. If we can do all of this and do it well together, we're going to be further developing our collaborative networks and upskilling so that we're able to really deliver on the mandate that we're talking about here today.
Perfect.
Great. Thank you, Mark. Over to you, Cassie, next.
Yeah, thanks, Mark. And maybe I'll just talk then a little bit about the mandate that's in front of us right now. And so Abby spoke earlier about the health data problem, which we know was really highlighted in the pandemic. We were challenged by a systematic fragmentation of healthcare, antiquated policies, challenges with data governance. And this has been, these sentiments and the opportunities to resolve these challenges have been well documented, such as through the Pan-Canadian Health Data Strategy. Over the next 3 years, Canada Health Infoway will work with our partners, such as our organizations and colleagues up here on the stage, and with all of you, to deliver a digital health and data interoperability program that will tackle the 3 objectives that Abby highlighted at the beginning: enabling a patient-centric model for data sharing, connecting care and care providers, and enabling digital health innovation. Our digital health interoperability program is a critical enabler for solving the health data problems and also aligns with the Pan-Canadian Health Data Strategy, whose core elements you see illustrated at the top of the slide in gray. This is supported by a 6-component strategic framework that you can also see towards the bottom of the slide. And this really underpins these efforts and starts to give us a collective vision for how we're going to move about having improved data sharing. The approach, which is based on international best practices, is built with a foundational layer that you see in the bottom boxes there, sort of in teal, that help to establish the common vision through a shared Pan-Canadian roadmap that you heard about earlier, and other elements like interoperability governance that helps to align our vision and make sure we're progressing towards this view, as well as the need for the development of data and exchange standards. It also includes an implementation layer that you see in the bottom on the right-hand side in the kind of mustardy color. And this focuses on the policy aspects, the behaviors, the tactics, the other things that are necessary, like trust framework, strategic engagement with industry, procurement activities that are necessary to really ensure that those core interoperability components are supported and can be implemented and adopted. So where are we at? Well, through the engagement activities that have been taken to develop the shared roadmap, there's agreement on 4 key priority areas, and you can see them here on the slide. The first is primary care data portability, and it focuses on a primary care data set to support interoperable health information exchange, and I'm sure Anne is going to share more about this in a minute. The second is the patient summary. You've probably heard a lot about that already today, and that's the Pan-Canadian specification to allow relevant health data to be shared and transported through patient summary care records. The third is patient access to electronic health data information, really enhancing the comprehensive amount of patient data that people have access to. And finally, e-referral and e-consult. And we know there's a lot of amazing work underway already on this regard across the country. And so the goal is to leverage this to develop a Pan-Canadian specification that can really improve the seamless exchange through interoperable health systems. So before I turn it to Anne, I just want to underscore a key message that you heard from Mark, and you'll keep hearing as we're up here. But it's critical. Our collective success on this journey is grounded in partnership and collaboration. We need the people, we need the processes, we need the technology to come together if we're going to make this real, but the time is now, and I'm really confident that we're on a great path forward. Thank you.
Thank you, Cassie. Over to you, Anne.
Thanks, Abby. Hi, everyone. I'm so pleased to be here with all of you today and with my fellow panelists. So less than a week ago, I was happily playing a backstage role in helping to plan this session. But as fate would have it, our Director of Spending and Primary Care, Ann Chapman, injured her foot. And so she couldn't be with us on this panel. She will be okay in a few weeks, but she's currently getting a first-hand patient experience into everything we've been talking about at this conference today, innovations in health IT and the gaps that still exist in information flow within our system. Luckily, our first names are the same, so it was easy for me to slot neatly onto this panel. And in a way, doesn't that so beautifully illustrate the benefit of using standardized terminology to enable the flow of health data for a modernized system? So we know we have an important task ahead of us. It is a matter of life and death for Canadians. Having the right information at the right time, at the fingertips of the right individuals, is necessary for a well-functioning health system. Now, many of you in this room have been on this digital health journey for a long time, and you may be saying to yourselves, what's different this time? We're all here to tell you that a lot is different. Stars are aligning in a way that we haven't really seen before in our industry. I wanted to highlight 5 things that we're seeing come together at the perfect time. So first, we have unified urgency at the federal, provincial, and territorial levels towards modernizing and connecting our country's health data to ensure that it is fit for purpose for clinical use, patient access, organizational operations management, health system use, and population health. Second, we have 2 Pan-Canadian organizations, Infoway and CIHI, that have been building up expertise in complementary but distinct areas over the past couple of decades, coming together in a partnership that's founded on a shared vision. We both hold separate pieces of the puzzle, and both pieces are necessary to enable our goal of connected care for healthier Canadians. CIHI will bring the Data and Standards Foundation, and Infoway will enable its interoperable exchange. Statistics Canada will also bring their standards expertise to this work. Third, we as an industry have an amazing asset in Digital Health Canada. As Mark spoke about, they are committed to building up the skill set that we so desperately need within our digital health community to ensure that we are successful in delivering on our plans. Fourth, we have made a lot of progress in this country. Every technology project that you have imagined, that you have completed, and that we've heard showcased here today puts those building blocks and foundational pieces in place to help us bring this vision to life. And fifth, we are not alone on this journey. Countries around the world that we've been speaking with, the US, Australia, Denmark, the Netherlands, the UK, they're all doing exactly what we're hoping to accomplish here in Canada. Everyone is tackling the problem in slightly different ways, but everyone is keen to learn, share, and build on each other's progress. At CIHI, we're all about standards and data. In the past, we have focused mostly on data for secondary use purposes to enable health system planning, and now we're on a change journey of our own. We've heard loud and clear that guidance is needed on how to represent data from the moment it is first created, when a patient interacts with the health system, right through to when it's aggregated and used for health system performance. And we're starting our journey with this new and broadened approach in the primary healthcare sector. 80% of health system encounters take place in primary care, and 93% of primary care clinicians use EMRs. However, the majority of people, providers, and health system planners don't have access to comprehensive primary healthcare data that they need for their roles. It's a sector that is ripe for modernization, and getting it right will benefit every other sector in healthcare. I want to leave you with this message. We cannot do this alone. The expertise and knowledge to make meaningful progress lies within the collective brains of everybody in this room. We need strong partnerships and engagement. CIHI and Infoway are well positioned as pan-Canadian organizations to be system connectors and conveners on this journey that we are all on together. Thanks.
Thank you. Thank you, Mark, Cassie, and Anne, for your perspectives. Now that we have a fulsome context on this topic, let's get started. So I'd like to begin a question. What are some of the accomplishments, the last 12, 18 months, that you would like to highlight that would further strengthen the need to have a more collaborative framework, the work through partnership, the work through alliances, and we often talk about, working together to advance this. So maybe I can start with you, Cassie, to reflect on some of those accomplishments, to give everybody in the audience an idea.
Perfect. Well, then that's easy for me to start this one. Hopefully everyone had a chance to be here with us this morning when the health minister was here and making the announcement about the shared pan-Canadian interoperability roadmap. But that's been a key accomplishment, and many of you have participated in that, and it's very exciting. It sets a vision strategically, as well as with kind of pragmatic building blocks to help us identify how we will move towards this goal to improve the digital health and data interoperability journey. And happy to say, too, if you didn't hear this morning, that the roadmap was endorsed by the Conference of Deputy Ministers back in March. So that's a really big thumbs up that we are moving in the direction and that we have a collective vision. So that's exciting. Another accomplishment I'd like to highlight, though, is the projectathon that was held this year. It was our second projectathon. It focused on the patient summary specification. And if you don't know what a projectathon is, it's a testing event where you can test and validate specifications like the patient summary specification. And this year we had more than 9 vendors, I think, participate and complete over 200 tests to test the security, the authorization, transportation, and the formation of a well-formed summary patient record. And so no small feat for any of the people that participated in these activities. So I think it's really good foundation for us to keep moving.
This is great progress. Mark, would you like to highlight some from your area?
Definitely, and I will take this opportunity as well as off script a little bit, but I want to give a shout out to the team, Digital Canada team that's put together the event that we're all sitting at here today. It's been an absolutely fabulous journey, and hats off to that team for sure, so way to go. Look, we're very focused on delivering a foundational set of events that happen with regularity at the national level, at the regional level, every week through digital technology with the webinar sessions, as well as putting in place places, including a new community forum where members and stakeholders can go to meet, to have important conversations about these topics, to find like-minded collaborators, and in so doing, keep moving the needle forward from that perspective. We just finished work on a new Digital Health Canada strategy, Strategy 2026, that's very focused on 3 components: excellence for members, delivering tools, methodologies, and programs that help all of our members and Canadians working in this space to ensure that they are empowered to deliver the best of digital health in Canada. The second part is acting for equity, and this is really focused on bringing together and ensuring that everything we do represents the cultural, generational, geographic, sectoral, and disciplinary diversity that exists in this realm across our country, and it's a critical ingredient for our success as we go forward together. And third is excellence, leadership for industry. And from this standpoint, it's bringing the best of industry, the best of each stakeholder group together to create and build upon the foundational knowledge assets and be a knowledge authority that's a first place, a first checkpoint for individuals working in this space. We're also very focused on bringing back our training program that we've partnered up in past years for newcomers coming to Canada with skills in the medical, the digital, and the technology space. We had a successful partner program, and as now provincial and federal governments are focused on the investments in digital health, this is going to be a fundamental enabler so that we can ensure that we have the people, the resources, and the knowledge in place to deliver on these programs.
Good. That's tremendous progress. And you want to touch on some of the accomplishments from your area, please?
Sounds good. So over the past year, CIHI has really been focusing on broadening our perspective on what are the information needs in healthcare. Traditionally, we've looked at what's needed from a secondary use perspective to support planning and management at a system level. Now we're thinking about what's needed to enable clinical care, for operational management within health delivery organizations, health system use, which is our bread and butter, as well as population health. We're applying this expanded perspective in the primary healthcare space, and key to our success are those engagements, partnerships, and collaborations. We've already begun speaking with a broad and diverse group of stakeholders to understand what is already out there that we can leverage. We don't want to start from scratch. And as we begin releasing the first versions of our products this fall, we're going to be expanding our stakeholder engagement. We'll be speaking with ministries, Crown agencies, vendors, clinicians, patient partners, and Indigenous groups to make sure we have all of the right perspectives and inputs into the work we're doing.
That's fantastic. All right, so let's engage the audience now. We're going to have a polling question. So a reminder, please open the HUA app. And if you could actually kindly go to your poll tab on the app. And you should see a question there. So which country do you think is the most advanced on their connected care healthcare journey? Canada, US, Australia, UK, or Denmark? This one is going to be interesting. I'm sure everybody has a different perspective. Okay. While we see the results coming, let's check in what's happening the virtual audience. I don't see Denmark there. Okay, so we don't see Denmark on the screen, but I can see Denmark is clearly unanimously voted as the most advanced country as far as connected care is concerned. So this is interesting, and it's sad to see at the same time, Canada being the lowest on this list. But I think this is a reminder of why we actually need to go back to working together and access something and not accepting the status quo. Clearly, something needs to be changed. So just building on that, I would like to ask our panel members, when we build this journey, when we build this roadmap or the approach together or the work that you're individually doing within your stakeholders, within your jurisdictions, what are some of the international perspectives you took into account, or what are some of the best practices you have built within your plans and approaches as you plan to actually advance this work within the healthcare space? So I would like to understand your thoughts on this one. Do you want to start with you, Anne?
Sure. So our approach is absolutely leveraging wherever we can and building on work that's already been done. We are not here to reinvent the wheel. There are countries around the world who are tackling this issue of interoperability and connected care. And we've started by speaking with the US, the UK, and Australia in particular. So in the US, we've been taking a deep dive into the data standards behind the US CDI, so that's the United States Core Data for Interoperability. With the UK, we've been looking at their open data dictionaries and data models that have been published by the NHS. And we've been speaking with Australia about how they've tackled stakeholder engagement. As we continue down this journey, we're going to be speaking with more of our international counterparts with this goal of learning best practices, learning about what's worked well, and bringing that back to Canada so we can leverage.
Thank you. Cassie, what about you?
I think the challenge will be like this could be a university thesis response. There's so much interoperability or international that's being leveraged. Maybe I'll just add then to what Anna shared. And the first thing is thinking, again, I mentioned already the patient summary record, but back in 2021, Canada, as part of the G7, committed to a standardized minimum health data set for patient health information, beginning through the international patient summary. And that work has been leveraged in Canada, so we're basing it on an international standard, and that's progressing really well. However, our work also contributes back to the international community, and through the development of the exchange standard called CAFEX here, we've been able to have engagements with international organizations such as HL7 International, IAG International, and we've been able to contribute, I think it's about 36 updates or changes to the international standards just based on the work that we're doing here. So I think the ability to learn from and contribute back is really strong, and I think that's a nice use case to point to. Another one, though, picking up on that, is the idea of collaboration. And Infoway has been really fortunate to participate in the Global Digital Health Partnership, or the GDHP. I don't know if many of you have heard of that, but it's several organizations from around the world participate in this countries. And there's various work streams, and those organizations or countries that are farther advanced in certain topic areas kind of lead the charge in certain areas, and then others can benefit from it. And those engagements, the lessons learned, the tips, the tricks, the strategies, the pain points, are all kinds of things that you wouldn't necessarily find in a strategy document, but they're critical and really valuable and to informing our work. And so we're really benefiting from that as well.
Okay. Thank you. Mark,
Yeah,
your
and there's
perspective.
great conversation back and forth, certainly between the organizations and being able to identify speakers and leaders that come to events. I want to highlight as well the fact that Digital Health Canada is the Canadian member of IMIA, the International Medical Informatics Association, and there's tremendous opportunities for members to go and participate in international working groups, which is a great experience. We, as part of our last strategy, which is the DNA of the organization, focused on bringing Canada to the world and the world to Canada, and that's a great tactical element for professionals to engage with. Just as a really quick story, we've got our friends here from the Netherlands at our conference today, and as representing Canada, had a chance to help their delegation set some meetings up in the country with the minister, the Dutch Minister of Health, Minister Keepers and Kuipers, and so he has a great analogy, which is very spot on for what we're trying to do in Canada in terms of training people, engaging people, and he shows a photo of an orchestra and talks about this orchestra is how healthcare was delivered or is delivered, sort of the past model. It's scripted. It's very enormous. It's happening at scale in a large building, and there are very specific skills that have to get implemented at very specific times as per a script in order to deliver that model. their focus is on moving to a jazz ensemble as the new model for this. And the idea is that if you have a common language, a set of standards, a hybrid set of skills that can be implemented, and people who can communicate together in real time, you can create amazing and beautiful music together. And this is the future of health service delivery in small, agile, skilled teams that can communicate well across disciplines. So I love that. We can adopt that from our friends in the Netherlands.
Oh, that's fantastic. My own personal view on this one is we spend a lot of time with each of these countries, and actually many more over the last few months, understanding what have been their challenges in terms of advancing. I think there are other variables when it comes to this particular topic, is what kind of health system they have. Is it a centralized health system, or is it a distributed health system? So those are some of the variables that also come into the play. And I think one common thing that I did understand, from talking to these countries is the barriers in terms of advancing the connected care. They're all are the same. All are the same. In fact, the order of the barriers are also the same. So nothing is different. Nothing is unique to Canada. Anyway, I think that's a nice build-up to the next question, that we have. So please get ready with the polls. And again, I'm going to make you work. Please open your Whova app. And I don't think you need any more instructions. Okay. So what do you think are some of the barriers to advancing a modernized, connected healthcare system? A, legislation, technical readiness, data standards, change management, all of the above. I don't think I'm going to be surprised with the response here. Super intelligent audience we have. Yes. All of the above. Yes. I would like to actually start off on this one, and I think this poll is, the results are no different from what we're gathering from the virtual poll as well. I want to specifically focus on one, and then I actually want to understand your perspective. One of the barriers then when we talk to most of the countries who are at a different stage of their advancing their healthcare journey is, in addition to the foundational work that you do with the data, the standards, the technology, or the infrastructure, one of the key enabler has always been a legislation. You need a legislation to provide an impetus, to the work that you're doing on the foundation level. So that was the fundamental thing that we heard everywhere. And whether you look at some of the policies that have come in the US through ONC, or the latest being the European health data space in Europe, where they're coming with a legislation to make sure that the citizens have access to their electronic data, but they can also manage and contribute their own data. Those are some of the legislation changes that have really provide velocity to the work that they're doing in terms of advancing their journey. But I would like to check with our panelists, in addition to what you saw there, or maybe with the options that you saw there, would you like to provide your perspectives on some of those? And we'll start with Cassie.
Sure. I can go first. I like to talk. Everyone knows that. I guess one of the things, I liked E, all of the above and more, because I do think that there's something about the coordination of it all coming together, right? It's maybe a little bit of your orchestra point, unfortunately, not quite jazz ensemble yet. But the fact that we need to think about funding, that we need to think about legislation, that we need to think about data and standards, but the coordination of all of that coming together. And it's going to be really important for all of us to understand our roles in this so that we can all pull on these levers at the right time to get the right people, the right institutions, and the right outcomes. And that's no small feat, right? That magic happening takes a lot of effort, and so we all have a role to play. So I think that's a key message that you need to walk away from here, is that we each have a role to play here. It's all of our obligations to do this, to improve for health data and the health system. And so definitely collaboration continuing in that regard is necessary. But I think we're on a good path for that. The other thing I guess I would say, it falls under that broad umbrella of change management. And that was another option there. But there's so many components, right, that are part of change management. The term means different things to different people. We have a national change management framework that was published years ago, but what's old is new again. So it includes governance and leadership, stakeholder engagement and communications, workflow integration, analysis and integration, monitoring and evaluation, training and education. A lot of stuff falls under there. And when we think about that context, and one of the pain points that we know is existing today with clinician workflow issues with solutions, there's opportunities for us to really come together working with clinical partners, such Mark you've been highlighting too, and industry partners to start to tackle that and accelerate how we can really get at the root cause so that we can get to the JAWS ensemble and be a little bit more agile.
Well said, Cassie. And would you want to please share your perspective too?
Sure. So in addition to the options we had there with those foundational pieces, one of the things that CIHI as a pan-Canadian organization can bring, and is really good at bringing, is being a system convener and connector. So we bring the right people to the table, we spark conversations, and that ultimately drives and fuels that progress towards our vision of a modernized and connected healthcare system. We know that we can't make interoperability happen overnight. If we want true, meaningful interoperability, the foundation of that has to be data standards that are normalized and ubiquitously adopted across the country. And that is a very challenging feat to accomplish. But we know the time to start is now, the will and the motivation exists, and we know that we need the input, expertise, and innovation of everybody to be part of this journey and help us design and implement that information highway for Canada that keeps the person or patient at its core.
Great said. I'm looking at the time, a few minutes left. I want to make sure that, if audience has any questions, so there are microphones there in these aisles, so I would like to see if any of you want to come up to the microphone and ask our panelists any question. While we wait for the audience to collect their thoughts and come up with a question, so Mark, maybe I can ask you a question. You talked about some of the gaps in the skill set and the talent and the workforce that we have, and the need to actually plan for the future rather than just focusing on filling the current gap. Would you want to share a bit more about where else we can think we can work together and actually solve that issue?
Well, we have a career matrix at Digital Health Canada that outlines a lot of the jobs. As we heard this morning, it's really important that we begin looking at the specific skills in each of those roles. But one of the things we do periodically, we did this a couple of years back, 2 years ago, was look at what are the new jobs, the new skill areas, domains coming. And at the time, looking at roles like cloud architect, for example, that was, at the time, it seemed like, wow, that's a very out there, future-focused job, and I'm sure there are, individuals in the room today who are operating in that, under that title in their organization. And so one of the things that, as we go forward this year and begin to bring forward members and volunteers, so a call to action for those who are interested to help in looking at not only our education and training materials in order to continue advancing and updating, building on the core informatics set, is also looking at some of those roles and skills in terms of where we're going. When the data is available in the cloud, when we have advanced governance around enterprise innovation, elements that maybe aren't there today in each organization, but will be as we look to leaders in the field in Canada and continue building as we go forward. At the end of the day, I'm hopeful, and it kind of goes back to the last question, that we can advance our clock speed of change in Canada around healthcare. I think through the pandemic, there was a lot of decision-making that was robust, but also moved, rapidly, relatively speaking. And I think it's, incumbent that we continue to look to, maintain and enhance the clock speed of decision-making so that we can move the industry forward.
Yeah, planning and building for a future is the key here. Yeah. Okay, so we have some. Thank you, Abigail, for the reminder. What is the most pressing blocker to making progress in the implementation of digital tools? I think we answered that, from a legislation standpoint, which is the most common or the most critical enabler that we need, or the countries have actually leveraged to advance their journey. Often we turn clinical staff into digital health professionals, making health human resources shortage worse. How can we make the healthcare sector more attractive to existing information professionals in other industries, for example, finance, energy sector, retail? Mark, do you want to take a shot at it?
Well, look, I think one of the core components, and again, I'm sort of pulling in some thoughts from this morning, but one of the key themes is that we're in this world now where the mission focus of your work is critically important and a critical enabler. And so those individuals that we are seeing coming to join as members from other industries often cite the fact that they've done 15 years in a different industry. They want to make a difference. They've gone through a health event with a family member. They've seen as an engineer, as a business leader, even as a clinician in a related but different area, coming into the technology and digital health sphere to make a difference. So that's one of those elements that we need to focus on as we go forward. And I'll go back a little bit to the clock speed and decision making. It's a frustration point for people who come in from other industries that we need to advance and innovate at scale and at speed. And so the more we can not only do that, but show evidence of that and build our evidentiary base as an industry to say we are making change happen, here's what it looks like, and talk about that in months and quarters rather than years, will really go a long way to advancing our ability to draw in those other professionals.
Great, thank you. There are a few more, but I think I can probably take one more. I'm looking at the ticker on the screen. And maybe this one is more appropriate for you. What happened to the core data set portability compliance standard promised by approved EMR vendors 15 years ago?
So I'm going to assume that that's referring to the primary healthcare minimum data set that CIHI had published about 10 years ago. We are using that as a base. We're building upon it. But as I said, we're expanding our focus now beyond secondary use, and we're looking at clinical care. We're looking at operational management within health delivery organizations, the secondary use, health system use piece, as well as population management. So that standard needs to be expanded in order to fit this broadened perspective that we have.
Thank you. Well said. So we're right on time, and we don't want to be standing between your social event. So we would like to wrap up the session now. Thank you, panelists, for your perspectives, and thank you, audience, for your engagement. We'll see you around. Thank you.
Please welcome to the stage your host MCs, Stephen O'Reilly and Sheila Maloney.
Important. We have a couple of things that we want to talk to you about, and I think the first one is the awards. And we've got, as you know, every year we do have a number of awards that we issue, and this year's no exception. And there's 3 categories of awards that we want to share with you today: the Digital Health Executive of the Year Award, the Digital Health Leader of the Year Award, and the Steve Husing Scholarship Award are the ones that I will announce, and then Steve will have one more after that. And then we'll give you details about the social night, so hang in. So the Digital Health Executive of the Year Award is awarded to an individual whose outstanding commitment to move the digital health agenda forward. There are 3 award recipients this year. Adrian Schauer, who's the CEO of AlayaCare, many of you know. Timothy Murphy, who's Vice President of Health at Alberta Innovates. And Kevin Jones, Senior Vice President of Canada for Strata Health Solutions. So congratulations, gentlemen. The Digital Health Leader of the Year Award recipients are individuals who are improving patient or provider experience and outcomes through digital health and virtual care. 3 recipients for this award as well this year: Michael Tattoo, Executive Director of Digital Health Strategy and Enterprise Architecture at PHSA in BC; Dr. Manal Glebe, Associate Professor of the University of Alberta, and Dr. Fred Malindi, Director of EDOC SNL. So congratulations. And the Stephen Husing Scholarship Award is awarded to a student or students who, again, reflect dedication and innovation in the field of digital health. Two recipients this year, Nadia Green from the University of Alberta and Ahmed Haroun Sayed from the University of Regina. So congratulations to them as well.
One second. That's okay. There we go. So thanks for hanging in, everybody. So Canadian Health Leadership Network, along with Healthcare Excellence Canada and eHealth 2023, are pleased to announce the 2023 recipient of the McNaught-Taillon Award, Leadership Award. Vivek Goel is a physician and President and Vice Chancellor of the University of Waterloo. Dr. Goel is Professor Emeritus at the Institute of Health Policy, Management and Evaluation at the Dalla Lana School of Public Health, U of T. He's a distinguished scholar with a long track record in teaching and research and administration. In addition to his medical degree, he's managed to pick up a couple of master's degrees in community health as well as biostatistics from Harvard. He's quite an accomplished guy. He's also the CHI board chair these days. And he spent his career really focusing on research to help make better health services decisions going forward. So this award was established in 2008. It's the first time we've announced it at this event. It's a new partnership for us. This honors the outstanding and lasting contributions of Don McNaught and Serge Taillon, who made enormous contributions to the Canadian healthcare system. Their vision, leadership, and mentorship really made significant contributions over the previous 40 years to improve health and health care for all Canadians through better, more accessible and reliable health information. And so on behalf of the partner organizations and the McNaught-Taillon families, it's our very great pleasure to turn this over to our 2023 reward recipient, Dr. Goel, who has provided a brief video acceptance.
Hello. I'd like to start by thanking the conference organizers for allowing me to take part by video this evening. I apologize that I'm not able to join you in person. I'd also like to thank the awards committee and my nominators for recognizing me with this honor. It is truly a privilege to receive an award in the names of Mr. McNaught and Monsieur Taillon. These are two individuals that contributed so much to the development of health policy, particularly Canada's Health Act, as well as health information through things such as the creation of the Canadian Institute for Health Information. Joining the past recipients of this award is an incredible privilege. This list includes individuals that I have seen as role models and mentors throughout my career. I truly appreciate that the award provides a bursary for a deserving recipient, and I'm privileged to have chosen Ashley Sid, a PhD student in the School of Pharmacy at the University of Waterloo, as the bursary recipient for this year. Ashley is working in important health policy issues and using technology tools to help educate pharmacists to keep up with the latest evidence-based practice requirements. Inasmuch as this award recognizes the work that I did in chairing the expert advisory group that produced a series of reports towards a pan-Canadian health data strategy, I share the honor with the other members of the group, as well as the staff that reported our work. Particularly Eric Sutherland, who is now working with the OECD in health data governance. We did our work through the pandemic, and despite never having the opportunity to meet in person, our group of very diverse individuals from right across the country, across many disciplines, from health services research, policy, law, epidemiology, public health, and including Indigenous perspectives and patient representation worked together incredibly well and developed a very close camaraderie. We remain committed to continuing to work on the implementation of our recommendations as they move their way through our different government structures. What I will note is our key findings were our challenges with moving forward in improving our health data and information systems are not technical. They're challenges of governance and accountability. How do we make the decisions that we need? And how do we hold those who make those decisions to account for living with the decisions and moving forward in a way that benefits everyone? How do we build the trust between different organizations and individuals, and particularly trust in the public and providers? In order to have trust, we need data literacy. People need to understand what we're talking about when we talk about different types of data. We need to think about our policy frameworks, and in particular, our policies towards health information privacy. And we need to think about our culture, a culture that does not reward stewardship of data, ensuring that is used in the most appropriate ways to improve the lives of individuals, their families, their communities, for public and population health, for health system improvement, and for research and innovation, while protecting and preserving privacy and confidentiality. If we can address these challenges, I know the technical solutions will be there. It's also important to reflect that the principles that we hold for our health system and the structures that we have were developed many decades ago. Mr. McNaught and Monsieur Taillon would not have imagined that our health systems would stay static over the decades. As technologies have evolved, as public expectations have evolved, so has the way in which we need to work in our health system. What you're discussing at this conference is critical to that evolution. E-health tools will be the future. They will ensure that the public is able to get what it expects and what it deserves. Once again, thank you very much for this honor, and I look forward to learning about the successes from this conference. Thank you.
Thank you. Wow. That concludes the formal agenda of day one of eHealth. You know, it's so amazing, and I think the energy in the room has just been palpable, so that's wonderful. And I suspect we'll all take that energy into the social evening that starts at 7:30 here. It's sponsored by Accenture. There's going to be games and dancing and fun and food and a live band, the Price Brothers Band, so that'll be a lot of fun. If you have, those who have RSVP'd have received a ticket. Mine is on the back of my name tag if you haven't found it yet, and so you'll need that to get in. And just a reminder, there's a free drink ticket for everybody, and after that, the credit and debit cards will be accepted. So I think that's it. And you've got one more thing to say?
Very quickly, if you are not attending the social night, we will see you.
You should.
And you really should. If not, give me your drink ticket. We will see you bright and early Tuesday morning for the networking breakfast sponsored by Salesforce at 7:30 a.m. right back here in the plenary room. That's it. Thanks, everybody.